Hi, this is Dr. A, and I have your third and last video on Chapter 13 about mental health issues. This is for Intro to U.S. Healthcare, and we are in the 5th edition of the Basics of the U.S. Healthcare System. So this is all about like miscellaneous topics, and then we're going to look at alternative approaches to mental health. So we're going to start with pandemic mental health. So the beginning of the COVID-19 pandemic had the most impact on people's mental health. This is when everybody was quarantined and we really didn't know what was going on. In April 2021, the NIM reported that rates of anxiety, depression, substance misuse were almost double compared to pre-pandemic rates. Students experienced higher levels of depression because they did not have adequate coping skills and experience with dealing with these difficult life issues. Nobody had really dealt with a pandemic at this scale. And of course, children were, sent home. They were having to do class at home, and they weren't interacting with their peers. It was definitely difficult. And then they could have also been dealing with, loved ones that were sick. A very difficult time. Similar to U.S. healthcare workers, many UK healthcare workers were considering changing their careers or taking a break because of the stress they experienced because of the pandemic. So let's look at mental health and disasters. So disasters can impact communities and their citizens. Disasters can be natural, such as hurricanes, earthquakes, floods, and tornadoes, or they can be man-made events, such as the September 11, 2001 terrorist attacks, Oklahoma City bombings, etc. Events impact individuals both physically and mentally, meaning you can be hurt physically in a natural or man-made event. But there is always a mental impact of loss. You can also experience feelings of shock, disbelief, grief, anger, guilt, helplessness, and emotional numbness when living through a disaster. However, those with long-term mental health issues as a result of these types of events are often not treated. We're often not looking at how they are a year down the road, 5 years down the road. The attention tends to be on the immediate event and the things surrounding the immediate events, but rarely on the long-term impact of the disaster. Mass shootings. So the United States has the highest number of mass shootings in the world. Tragic events such as this type of mass violence also creates PTSD, which can be tied to drugs and alcohol abuse down the road. You get the event, the disaster, whatever, the person that was subjected or exposed in some way to the event can develop PTSD. PTSD down the road as a way to cope with it can lead to drug and alcohol abuse. It impacts not only those who lost their loved ones, but also the survivors and the healthcare professionals or the first responders who cared for the survivors. So there are more people impacted than those who are killed. Approximately 95% of people exposed to mass shootings experience PTSD symptoms immediately after the events and continue to experience these symptoms months later. So it's really imperative that they get help. PTSD is not typically diagnosed until 1 month after an event. So this model we're going to talk about is called Before Stage 4. And Mental Health America has developed this proactive philosophy model called Before Stage 4 to treat mental health like any other disease, such as cancer and diabetes. So they stage it kind of like cancer is staged. So for stage 1, you would have mild symptoms and maybe there's some warning signs that are popping up. Stage 2, the symptoms start to increase in frequency and severity and to interfere with life activities and roles. In stage 3, the symptoms worsen with relapsing and recurring episodes accompanied by serious disruption of life activities and roles. And then stage 4, symptoms are persistent and severe and have jeopardized one's life. So again, it's if you think about it in terms of even just cancer, like ideally you want to find cancer in stage 1, maybe stage 2. This is when it is ideal to intervene, to get therapy, to get help, and all of that. So you don't really want to find it in stage 4. Well, it's the same thing with mental health. So with cancer and other chronic diseases, the medical community recognizes early symptoms and hopes to treat them before they progress to stage 4, which is typically the end state of a disease. Mental Health America is proposing to apply the same philosophy to recognize early signs of mental illness and treat them before it progresses to a more serious mental health illness. The focus, therefore, then is on early identification and intervention, which then requires training. So next, the ADA and mental health. So the ADA defines mental health impairment as a mental or psychological disorder, an organic brain syndrome, an emotional or mental illness, or specific learning disabilities. And this is important to know because then if a person falls into any of these categories, the ADA then accommodates individuals with these issues, and oftentimes you can get accommodations in the workplace or school around those issues. Now we're going to dive into alternative approaches to mental health. They emphasize the relationship between the body, mind, and the spirit, and how everything is all intertwined. So self-help organizations. Many mentally ill individuals seek comfort in self-help organizations around maybe a specific, problem diagnosis, or even a grief support group, for example, is a form of self-help organization. Nutrition. Some research has demonstrated that certain types of diets may assist with certain mental disorders. Just having appropriate nutrition. There are some really interesting studies that show that in prisons, if you put the prisoners on multivitamin daily, that's it, just add multivitamin to their daily regimen, violence drops significantly in the prison. So having all of the things that you need to make all of your neurotransmitters and your happy brain chemicals and for your body to function properly is key to your health. All right, pastoral counseling. Mental health counselors have recognized that incorporating spiritual guidance may help alleviate some symptoms of mental illness. So things as resorting, for example, to prayers or group prayers, talking to a pastor, an elder, a preacher, or somebody that can offer spiritual guidance, as well as some mental health counseling. There are cultures like African American and Latinos that especially prefer this type of intervention for mental health because it tends to be more culturally competent to their needs, and at least is a good way to address their needs for mental health. There are also animal-assisted therapies. Animals are often used to increase socialization skills and to encourage communication among the mentally ill. It can be things like, of course, having a therapy dog or cat, but even we have locally an organization that will take children that are in foster care that experience traumas and difficulties and help them to care for horses as part of hippotherapy, and it really helps them in their healing process. Art therapy, activities such as drawing, painting, and sculpting may help people express their emotions and help treat disorders such as depression, so they can get all their feelings, all their things out in a different way other than using words. So that can be very helpful. Also, dance therapy, moving the body to music may help with those individuals recovering from physical abuse, but really anybody that's experienced stress, you can even kind of like shake it out of your body, and just you can be to music or not to music, but it's a way to physically kind of release stress and emotions from your body. Music therapy, research supports that music elevates a person's emotional moods. It has been used to treat depression, stress, and grief. Again, the same way where we can kind of like express our feelings and things, not specifically from singing, although singing definitely can be something, or creating your own music, but just even just listening to music that is expressing some of the things that you are feeling. Acupuncture. Is the Chinese practice of insertion of needles in specific points of the body to balance the system. It has been used to treat stress, anxiety, and depression. Again, trying to balance the energies, and it affects your body, spirit, and your mind. Ayurveda medicine, so this is from an ancient Indian practice. It incorporates diet, meditation, herbal medicine, and nutrition to treat depression and to release stress. If you've ever taken ashwagandha to help with stress resilience, that is Ayurveda. Yoga is an Indian system that uses breathing techniques, stretching, and meditation to balance the body. There have been a lot of interventions with our military veterans that use some of the Ayurveda, especially, the meditation and yoga to help veterans with PTSD, and they have had more success with that than with medication therapies. So Native American practices, ceremonial dances, and baptismal rituals to treat depression. So again, this is part of culturally competent care for that population. Biofeedback, so this technique focuses on learning to control your heart rate and your body temperature. This technique may be used in conjunction with medications to treat depression and schizophrenia. If you want to see an example of that, look up on YouTube Iceman, Wim Hof, the Iceman. It's a really cool kind of example of what he dealt with and how he used cold therapy for biofeedback therapy to help combat depression. Visualization, the patient creates a mental image of wellness and recovery. So if you can see it in your mind, your body will do it. And there's a lot to that. So like belief can be really a foundational thing to healing. So if you don't believe that you should be healed or healthy, you're going to have a very difficult time becoming a healthy person. But if you can visualize yourself as a healthy, strong person, mentally well balanced, you can visualize that your body, whatever you put in your brain, your body is going to make it. Your brain's going to tell your body to make it happen. So it's really a very interesting technique. Also massage therapy, so manipulating the body and its muscles is used to release tension. It has been used to treat depression and stress. And so let's conclude our mental health chapter. So treatment of mental health disorders has traditionally been underfunded because of the attitude of the traditional healthcare system, confusion by health insurance companies, and fear by individuals who are mentally ill that they will be discriminated against. So there's a lot of stigma. Things aren't paid for as well. And again, so part of the traditional healthcare system was to look at all the biological processes, all the things that we can quantify, and all of that have become part of traditional medicine. And then like everything that was above the neck, so the brain and all of that was mental health. And they just separated the two, this separation. And this has happened, 100 or 200 years ago. This really started this dichotomy of separating spirit from body, but we really need to bring it all back together. So mental health illness can be mild or it can be life-changing. Anxiety, eating, and personality disorders are common in the United States. Common symptoms include depression, substance abuse, feelings of anger or hopelessness, social withdrawal, and changes in sleep and eating habits. 16% of those who abuse alcohol also report mental health issues. So that wraps up chapter 13 on mental health. And we have one more chapter, which is going to be chapter 14, and that's going to be in our next video. I'll see you there.